adipose tissue.
Okay, what is found in the adipose tissue, the subcutaneous layer? Perfect. Okay, so why not here? Why not here? Why here?
Because there's no adipose.
But there's still some, but very minimal. Okay, the answer is very simple. There will be uniform what? There. What did you say, Ms. Romero?
Absorption.
Perfect. That's how you perfect exams. Knowing the reason why. You always ask yourself why, how, where, and when. Where do I inject? Abdominal wall. How do I inject it? Is it IV, intramuscular, or sub-Q? Sub-Q. Why? Because there's so many blood vessels where? In the hypodermis layer or the subcutaneous layer. Are there any blood vessels in the epidermis? None. Are there any blood vessels in the dermis? Yes or no? Silence means you're thinking, I presume, right? Are there any blood vessels in the dermis? Yes or no? Still quiet, okay. Are there any blood vessels in the dermis?
No.
Okay, who says no? Okay, who says yes? Am I only the one raising hand here? Am I the only one who's correct? I'm just joking. Of course, there is. My goodness. Have you forgotten your lectures on the skin? That is chapter 4 of Martini textbook, 9th edition. How can we forget our lessons in anatomy? We will be lost if you don't remember them. Believe me. It is only the epidermis that does not have any blood vessels. You have blood vessels, therefore, in the dermis. I just said only. So that means there is blood vessel in the dermis. And which do you think has more blood vessels, dermis or hypodermis? Which one has more blood vessels, the dermis or the subcutaneous layer? Is subcutaneous layer the same thing as hypodermis?
Yes.
Hypo means below what? Dermis. Dermis means skin. Dermatology. Remember the words? Dermatologist. Okay. Why do we prefer the subcutaneous layer? Because it has more what? More fat or more blood vessels? There you go. Why here? Uniform absorption. You can obviously see the evidence. If this were a court of law, your judge, your honor, exhibit A. Fat. Okay. Why here? Uniform absorption. Now the method of injection. We know it's subcutaneous layer. Are we going to inject in one site or are we going to rotate injection sites? Okay, why do we rotate? You see? Do you notice whatever I ask, there is always a follow-up what? Of what? Why? And that is how you must think. That is how much you learn. When you read the book, you don't have to wait for me to explain to you. You have to ask yourself and do the research. Why do we rotate the injection sites? There must be a reason, right? Anyone? Karen?
Prevent cellular injury.
Prevent cellular injury. Where did you read this, Miss Karen?
If you keep causing trauma to the same site, it's going to cause bruising and
Bruising. Is it the bruising? Okay. Okay. Let's relax. Chill. So, if this were a Facebook thread on Facebook, you know, the topic is what? Subcutaneous injection. What did I say a few minutes ago? Let's say it was 3 minutes and 30 seconds ago. What do you find in the subcutaneous layer? And where is this blood vessels embedded upon? What kind of cells? Adipocytes, adipose cells, right? The answer to my question, therefore, is very simple. If you inject on the same site, what do you do to the fat cells or adipocytes? You destroy it or you destroy it? You damage it or you damage it? Is that the answer to my question? You see what I'm saying? There is no question that you cannot answer here. Does it make sense? Do you understand why it's so important to know your anatomy? Right? So it's called lipodystrophy. What does lipo mean?
fat.
OMG. Does that make sense? Don't you get excited when 1 + 1 is equal to 2? Why would it be lipodystrophy? Because you damage what? The fat cells where? In the subcutaneous layer. Because you're going to, what is the method of injection? Subcutaneous, intramuscular, or intravenous? You see what I mean? So it has to be rotated. Will this come out in the nursing board exam? 100% sure. Because when you work as a future nurse, if the doctor tells you, give the patient insulin, 5 units, I expect you to know that I have to inject it what? And there is a method. You will learn that in core nursing, even the angulation of the needles, right? You understand? Okay. Because if you don't rotate, you develop damage of the fat cells called adipocytes, right? Okay. Now let's deal with the different types of diabetes mellitus, right? Okay. You have type 1, type 1, 2, and what's the third one? What's the third one? Okay. Type 1, remember. Are we still good? Good, okay. Type 1. Okay. I don't want to be talking and there's no power actually. What's another name for type 1? Another name for type 1. Anyone? You have read the book. You have read all the 5 chapters. What does type 1 mean? Another name.
Insulin dependent.
Okay, very good. It's called IDDM. What about type 2?
Insulin resistance.
NIDDM. What does N there? Non-insulin dependent diabetes mellitus. Correct? Okay. Now, what is the etiology or pathogenesis of type 1? What is the problem here?
There's elevated B cells.
So what happened?
Insulin is not being.
Yes?
Insulin is not being.
So is there little or zero?
Zero.
Perfect. 0. Why? Why? What is the pathogenesis and mechanism of the pathology here? Yes? Anyone?
Beta cells.
The beta cells, yes?
Destruction.
Why? Why would there be beta cell destruction?
Autoimmune deficiency.
Okay, I like that's the word I want to hear. You know, I want you to think fast, right? So it's called autoimmune. Remember this? Remember the type 3 hypersensitivity reaction. So your own body attacks what? The beta cells through the antibodies and the T cells. Okay, so you destroy what? The beta cells, and because of this, is there complete destruction or annihilation? Yes. 0. That's the reason why. How much insulin is produced?
0.
So, what would be the treatment of choice?
Insulin.
That's why it's called insulin dependent. You know what an English word means? Dependent means the only way I can give treatment to this patient would be what? Giving insulin to this patient, right? Treatment would be what? Insulin shot, right? Subcutaneously. Okay. Question now is, so if there is no insulin, there is no key, the glucose cannot enter the cell, what will be the alternate source of energy for the cell? Fat will be utilized as a source. And in the process of utilizing fat as a source of the alternate source of energy, what is produced? Ketone bodies. And what are ketones? Are they acidic or are they acidic?
Acidic.
So do these patients develop DKA or diabetic ketoacidosis?
Yes.
And what exactly is that? Is that respiratory acidosis or metabolic?
Metabolic.
Why metabolic?
Because it's not.
You're not involved in what organ?
Lungs.
Do you understand? You notice I keep on asking why? And that is what you should always ask yourself. You don't have to wait for me to give you the answers. And that is hopefully probably the best thing that can happen in blended learning, right? You research, study. It's not teaching yourself. It's actually teaching yourself to be smarter than the teacher. You want to be smarter than everybody else in the world, right? Do you get satisfaction when you get to see something and, oh, 1 + 1 is equal to 2. Oh, there is no glucose entering the cell because there is absolutely what? No key to open the door. And in order to survive, the cell has to use what? Fat as an alternate source of energy. And in the process of doing so, you end up producing ketone bodies, which are acidic substances. You develop diabetic ketoacidosis, and you said it is what? A form of metabolic acidosis. What would you expect the pH to be? Huh?
Low.
What do you mean low? You have to give me a number. Less than what?
Less than 7.5.
See, I want to be fast. You know why? In your nursing board exam, you only have 90 seconds to answer every question. 265 questions to be answered in 6 hours and 360 minutes. Based on my calculation, 90 seconds per question. Do you understand? Okay? So, pH will be less than what?
7.5.
Perfect. Is it acidic? It is. It's called metabolic acidosis. Correct? Okay? Now, what about type 2? What happened in type 2? Huh? So what happens here? The pathology. If this is autoimmune, what is the problem in type 2?
Very little.
Yes? Kelly?
Very little insulin is.
Okay, there is what? Here 0, it's little. In other words, I need how many keys to open the door here for 3 cells? I need 9. In here, I only have how many keys? Maybe 2. Maybe 2. This is just an example. What happens if I have 2 keys? Can I open all the 9 doors at the same time?
Yeah.
Have you ever been to a movie house where only one person is selling tickets?
Yeah.
What happens with the line of people wants to enter in the cell or the movie house? It's a big long line, right? Because one person is only selling tickets here, all the other people are not doing anything. They're just waiting for you to form a long line, right? The same thing here. So will you still also have hyperglycemia here?
Yes.
Because they can't go inside the cell. So they're waiting for the turn. Okay, I'm here. How are you, glucose number 2? I'm glucose number 3. I have no choice. I have to wait in line. Because there's only one key to open the door, right? Okay, now what else? So therefore, what is happening here? How would you explain the problem of type 2? Why is there little insulin? Yes? It's not autoimmune, right? What is it? Yes, my dear.
The B cells are destructing and
The beta cells are what? Completely destroyed or partially destroyed? The beta cells are partially malfunctioning. Malfunction, right? Which means not all the cells probably are destroyed, right? Which makes sense. If only a few cells are producing insulin, that's why it's little. What else?
Receptors.
Okay, who said receptors? Who said receptors? What about receptors? Huh? What happened to the receptors?
They're either like non-reactive, they're not functioning, or there's not enough receptors for it.
There are not enough receptors, or what the term they use in the book? Could there be defective receptors? It could be impaired, leading to insulin resistance. Have you ever encountered the word insulin resistance?
Yes.
If you did not, that means you have not read your book, right? Right? What is the meaning of the word resistance? In other words, remember what I said about the key. What are the features of the key for it to become effective? See the groove? There? So that doorknob, which represents the receptor, should correspond to this, right? Groove, so that it can open the door. In other words, if the shape of my key is like this, key, then the doorknob should what? To be able to what? Match. You understand? Now, is it possible that, like example, just analogy, if I put something in the doorknob, I put there epoxy, can I even insert the key? It can't, right?